call the meeting to order. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone. We are going to start the meeting with our roll call. Catherine?
Director Wallace?
Present.
Director Nicholson?
Present.
Director Stewart?
Present.
Director Danielson?
Present.
And Director Eakin is away.
Thank you. All right, now we're going to move to the education session, and we're going to ask Chris Henry to come to the podium and introduce our speaker.
Yeah, hi, tonight we have Mr. Ed Fayen and Mr. Jack Balch to present to the board the Citizens Bond Oversight Committee Annual Report. We're all very familiar with Mr. Fayen, but I'd like to give you a little bit of background on Mr. Balch. Jack W. Balch is the president of Balch Enterprises, a family-owned company in Hayward, California. Balch Enterprises has evolved into a full-service, vertically integrated builder-developer specializing in the development and construction of concrete tilt-up buildings. The company has been listed as one of the largest developers and property managers in the Bay Area. Mr. Balch is the remaining original member of the Washington Township Healthcare District Citizens Bond Oversight Committee, which was formed to monitor funds from Measure FF. In the past year, Mr. Balch has stepped in as interim chairperson of the committee, and we really appreciate Mr. Balch's service on that committee and his insights and expertise. So with that, I'll invite to the podium Ed Fayen and Jack Balch.
Thank you, Chris. So, just a quick recap, as Chris had said, Measure FF was a measure that the voters of Washington Township Healthcare District approved in November of 2004 to authorize the rehabilitation, expansion, and improvement of facilities at Washington Hospital. And the Board of Directors founded and appointed a bond oversight committee made up of community members from the Tri-Cities with the responsibility to monitor and report to the community that Measure FF funds were being reported appropriately, or were being expended appropriately. So Measure FF, as passed, was to provide for only essential repairs and upgrades, including state-required earthquake safety measures as dictated by SB 1953, an upgrade and expansion of the hospital's emergency room and intensive care units, expand rapid state-of-the-art cardiac facilities, including operating rooms. But before those clinical things could be taken care of, the building systems, particularly the electrical and the mechanical systems of the hospital, had to be upgraded and expanded to be able to put together buildings that would provide the new clinical services. So that was also a reason for the Measure FF funds, and also to provide various upgrades to walkways, pickup zones, and drop-off zones. Measure FF authorized the issuance of $190 million of GO bonds for these expenditures. And so we have had ongoing bond oversight committee meetings for the past several years. They are quarterly, and Mr. Balch heads those up. So without further ado, I will have him give you an update.
Thank you very much. This is our third annual report. A copy of this report has been handed out. If anybody is watching and would like a copy, they can get it by calling the Community Relations Department of the hospital. We had a very diverse and very capable, or I should say we have, you haven't disbanded us yet, oversight committee with a lot of varied expertise, and I think everybody's done a very good job. We're now nearing completion on the central plant project. Oh yeah, I've got to remember to push the button. Spending approximately a little under $70 million of the total bonds that were funded to date. I'm sure most of you have toured this facility and see its state-of-the-art with, thank you, state-of-the-art, built to the latest earthquake standards. It was very impressive to watch this facility being constructed, and talking to the different contractors you had, very, very impressed, and just a great facility. They took into account the life cycle of the equipment that was put in. There was a lot of forethought that went in the design of this that was very impressive. This facility should be going into operations very soon if it hasn't already. One of the things I was very, very impressed with from the onset was this building information modeling, the BIM, where they actually did a 3D drawing of the facility. I think the money that was spent for this saved millions of dollars in constructions with the conflicts they were able to find and address ahead of time. It minimized change orders, minimized costs, and I think was a very wise decision on staff's part to do. You can see the picture of the facility that was constructed. We have a highlight of the financials of the project to date. And again, the complete financials are available in the annual report for further review. This is only the first phase of other projects to be constructed. Additional monies will be spent from the financing. In being involved with this project from the start, I was very happy to see the quality of people that the hospital chose to work on this. I think you made a very, very wise decision to use Swearington Builders and to work with them on a cost-plus contract. I think that also saved you a lot of money. You had a very capable person in Bob Grousey from Jacobs Engineering that was at every meeting and could explain the construction in detail, along with Ray Grouse, who you hired to help us understand how the money was being spent and to make sure that it was not spent ahead of time and we did not get upside down where we spent more money than work had been done. And then your staff of Ed Fayen, Chris Henry, and not to forget Maria, they were all just excellent people to work with and made our job on the Citizen Oversight Committee very, very easy. Does anybody have any questions?
Any questions, any board members? No, I don't think we have any. But Mr. Balch, we certainly want to thank you for your service and for the other committee members. It's a very important role that you fulfill in looking over how the district's monies are spent and used to accomplish the wishes of the residents of the district. And this facilities and others that follow will not only benefit them, but they'll benefit many generations to come. So thank you very, very much for your work.
Thank you very much.
Okay. We are now going to move for the consideration of the minutes for the December 14th, 19th meeting of 2011 and the January 3rd meeting of this year.
So moved.
Okay, all those in favor? Aye. Opposed? Motion passes. Okay, we will now move to the communications portion of the meeting and entertaining oral communications. All right then, moving on. Dr. Romano, please.
Thank you, Mr. Wallace. I'd like to present the credentials actions from the medical staff for the last month. Recommended for appointment are Drs. Jeffrey Thomas, neurosurgery, to the provisional active staff, Dr. Gregory Perrone, a teleradiologist, to the provisional courtesy staff, Dr. Sachin Parikh, an otolaryngologist, to the provisional active staff, and Monette Thiel, a perfusionist, to the provisional allied health staff. The reappointments for recommendation are Drs. Ramiro Garcia in medicine, the active staff, Frank Hockman, family medicine, to the active staff, Kimberly Horstman, Pediatrics, to the active staff, Aditya Jain, Cardiology, to the active staff, Dr. P. Kudravalli, in Internal Medicine, to the active staff, Peter Lunny, Nephrology, active staff, Maha Malakana, Pediatrics, to the active staff, Rohit Siegel, Cardiologist, to the active staff, Shali Sinha, Pediatrician, to the active staff, Shirley Tsai, Pediatrician, to the active staff, Albert Wang, Internal Medicine, to the active staff, Ranu Grulbal, Radiation Oncologist, to the active staff, Carol Kawada, OBGYN, to the active staff, and Jacqueline Way, orthopedist to the active staff. Transferring in staff category are Doctors Hockman and Sinha to the ambulatory staff. Those we're recommending for staff status advancement are Dr. Peter Barnett, an emergency medicine physician, going provisional from provisional active to the active staff, and Dr. Lisa Lamb, going also from provisional ambulatory to the ambulatory staff in family medicine. In C3 on the following page, we would like to discontinue proctorship and have staff status advancement for Dr. Puya Jazieri, an anesthesiologist. This is his initial proctorship, and he will remain, advancing him from provisional to the active staff. We would like to extend proctorship and hold the staff status advancement for 6 months through July 31st of this year for Randy Mastretti, a physician assistant. Under D, the request for additional privileges, you notice there's a change. There was an error in the name of the physician, and the correct name is Sudipti Prasad, and she's requesting privileges in the use of the Da Vinci robotics, and we'd like to recommend that to you. A request for withdrawal of privileges, there are two, Dr. Connie Widdowson and Shakira Carpanini. They're both requesting to withdraw their obstetrics privileges and maintaining their gynecology privileges. Dr. Piali Dattare is requesting a leave of absence for personal/health reasons. And finally, we have 4 resignations: Estella Ayala, Dr. Jacqueline Labad, Dr. Tammy Miller, and Dr. T. Yenamul Akbali in medicine, all for relocation. That's
Thank
my
you.
report.
Thank you, Dr. Romano. May I have a motion for the approval of the medical staff credentialing action items?
So moved. Second.
All those in favor? Aye.
Aye.
Opposed? Motion passes. Okay, Maria, good to see you.
A blessed 2012 to everyone. Good evening. My name is Maria Teresa. Tonight I would like to report to you or to share with you the Service League activities and events. First is about the East Bay Council. As a volunteer organization, we are members of the East Bay Council that consists of 14 hospitals located in the East Bay area. We meet 5 times a year to discuss each hospital issues and ideas affecting the organization. On behalf of Washington Hospital Service League volunteers, I would like to extend my great appreciation to 2 of our members that retained a position on the EBC Board of Directors, and they are Cherie Gamardo, EBC President-elect, and Jose Aguirre, Treasurer. Next is California Hospital Volunteer Leadership Conference. As a member of the California Associations of Hospitals and Health Systems, we send a group of volunteers each year to the Hospital Volunteer Leadership Conference. This year, it is being held at San Francisco. It is a great opportunity to meet other volunteers, participate in seminars, and to hear great inspirational speakers. This is a rewarding experience for everyone attending. And this year, 2 of our incoming new board will be attending this event. And then Washington Hospital Scholarship Washington Hospital Service League scholarship. I would like to acknowledge Gail Tomita, who was appointed to be the chairperson of the scholarship committee, thanking her for accepting this appointment. And the Washington Hospital Service League will also award 2 4-year scholarships in the amount of $1,000 per year. For each of the 4-year of the scholarship, the winning student must be studying in a health-related field and remain in a good standing at their school. Some of the criteria for this scholarship application is as follows. They must live within the Washington Hospital District, must be full-time student with good standing, must be a U.S. citizen, must have 100 hours either work or volunteering experience in the health-related field. Copies of the applications with details for the criteria for scholarship have been submitted to the high schools in Washington Hospital's district. Scholarship applications are available in the Washington Hospital main lobby desk, and it also can be obtained at the Washington Hospital's website, which is www.whhs.com, under Community Connection Scholarships, Service League Scholarship Application. Now the Service League is now busy preparing for the 57th annual meeting, which is going to be held here in Washington Hospital West Anderson Auditoriums on February 13, 2012. I hope you leave that open in your calendar, because we're now in the process of putting together the program, and Washington Hospital Board and guests will be receiving the invitation soon. And last but not least, I would like to say something about Anna Elola's retirement. An ice cream social and cow liquidation were held last January 3rd, 2012 at Washington West Anderson Auditorium to celebrate Anna's retirement of 40 years service at Washington Hospital. Anna's family was also in attendance at the social, and they even served the ice cream to all the adults that paid tribute to Anna's retirement. We all had wonderful time celebrating, and we had fun checking out all Anna's cow collection through the years. It's all so cute. The monies from this liquidation will be going towards the scholarship fund in her honor. It was hard saying goodbye to Anna, but we hope to seeing her soon if she volunteers. Anna will be missed by all of us, and most especially those hearts that she touched. So for now, I believe see you later will be more appropriate than saying goodbye. We wish you well, Anna, and God bless you. This concludes my report for the evening, and thank you very much for your time. God bless us all. Thank you.
Thank you, Maria. Thank you. Any questions, comments? Thank you.
Thank you very much.
Dr. Romano.
Following is the medical staff report. The applications in progress are the following. There are 13 in progress. However, 3 have been voided since, pre-applications. 3 have been voided since they were not returned within 90 days. So we have 10 active pre-applications that are out there. We currently have 11 applications being processed, 4 of which are from pediatrics and the rest are from various specialties. We had 3 applications which were acted upon tonight, and we're anticipating 2 more for next month. So overall, this brings us to our total number of members of the medical staff, and that would be 539, including the allied health, and of those, 401 are either active or provisionally active.
Okay.
And that's the end of my report.
All right. Thank you. Thank you, Doctor. All right. Jan, please go over the hospital calendar, please.
Okay, we'll start with Ed doing a construction update.
Oh, I'm sorry.
We have to do that first.
Okay.
We have a few things to talk about for the central plant, and that's for the utility connection portion of that project. So the generator, the emergency generator, the large, I think it's 750 kilowatt generator was removed at the beginning of the month, and work started on the final portion of this project, which is to connect the normal PG&E power to the existing plant. So where the emergency generators were has been cleaned up, the generators removed, and that's been dug up and new concrete poured. And now new transformers for normal power from PG&E will be placed in this room and then connected to the central plant. And that will be the pretty much the end of the central plant project. In the meantime, final connections are happening for the laundry and to make all that operational. And we anticipate probably the end of this month moving laundry operations into the central plant. So those are the main things that are left. As you know, we were commissioning and did emergency power last month, and we are continuing to do boilers and everything else. And most of that is, if not complete, will be completed within the next 2 weeks. For the Center for Joint Replacement, we are getting to the finishes. So this gives you the nurses' station on the what is the second floor of the building, but the first floor of patient care. And you might also note that if you frequent the hospital's first floor at all, there is going to be a continuation of the main hallway that comes down from the information desk and then goes down past the surgery waiting room and the doctor's lounge, and that hallway will continue and be the connecting corridor to the CJR. So that was actually opened up about 2 weeks ago. So things are coming together for this project to be completed. We're still talking about a final completion of construction in April and a move-in in a May timeframe. This just gives you a shot of a patient bathroom, patient shower, which each room has a handicap shower. And this is just work again in the corridors. This is actually on the second floor, and this is a main second floor corridor outside of Dr. Dearborn's office. And work continues on the exterior, the therapy garden, and they're continuing to pour the forms for that walkway. And so again, in summary, we're still functioning well within our budgets, and we anticipate a final completion in the April timeframe for the CJR, and pretty much wrap up this month with Central Plant. Okay. Any questions?
I'm just curious what happened to the old generators.
The old generator, the Waukesha, the manufacturer, took it away from us at no cost. It's something it was a combination of something that they wanted to keep because of its age and condition. And our guess is that there's going to be a need for parts because those are hard to come by, but we heard comments about them wanting to keep it as sort of a museum piece. Yeah. So the company itself took it out for free, for no charge, and that's what happened.
That was my question. I thought maybe we might see it at the Smithsonian.
Who knows? All right, thank you.
Great. Thank you, Ed. Jan?
To begin the calendar, it was on January 3rd, we had Stroke Education Series, Stroke Prevention and Other Disease Processes. We had Dr. Kalon, our neurologist, and Doug Van Houten, who presented the program, and there were 16 in attendance. On January 5th, we had Diabetes Matters, which was a dietary supplements, what you should know. We had our dietitian, Lori Rolfson, and she's also a certified diabetic educator, and she presented on the essential supplies our bodies need. There were 31 in attendance. On January 9th and 10th, We had Detective Amy Boyd and Community Engagement Specialist Martha Matheson from the Fremont Police Department, and they presented to Washington Hospital employees, volunteers, and the medical staff on personal safety and fraud and how to reduce chances of becoming a victim, and we had 93 in attendance. It was very well attended, and we heard a lot of very positive comments back on that one. On January 10th, we had the Speakers Bureau on how to use the Community Health Resource Library. Lucy Costello, one of our operations coordinator for the library, presented the program to the Mended Hearts. There were 8 in attendance. On January 10th, the Women's Health, Cancer in the Family, Am I at Risk? Was presented at Washington Women's Center. Dr. Vandana Sharma, our oncologist medical director, and Nikki Chu, who is the certified genetic counselor, provided information on what might benefit, who might benefit from genetic testing, and there were 15 in attendance. On January 12th, there was a community event, which will be I guess it's tomorrow, the Washington Township Medical Foundation Newark Clinic Open House from 5:30 to 7:30, and it will be at the Newark Clinic. And the Washington Township Medical Foundation, in conjunction with Washington Hospital, will host the open house to celebrate the grand opening of the relocated Newark Clinic. The new facility includes a modern conference center designed for health education and community outreach programs. There will be an offering of primary and urgent care services that will be open every weekday and offer same day as well as walk-in appointments. It's been retrofitted to withstand a sizable earthquake, and so the clinic will also serve as an important local resource in the event of an emergency. The Newark Clinic opened to the patients on December 19th, 2011. January 18th, we have Women's Health Exercise for Your Health. It was held at the Women's Center. Kathy Hesser, our Washington Women's Center coordinator, will be discussing several types of exercise from a women's perspective. On January 21st, we have Speakers Bureau. It will be osteoporosis and blood pressure, what you need to know. Dr. Barry Shabuza. Thank you, Shabuza. Our rheumatologist will present on osteoporosis, and Doug Van Houten will present a blood pressure at the quarterly meeting of the American Association of University Women. On the 28th, there will be a community health screening for abdominal aortic aneurysm screenings from 10 to 1 in the Newark Clinic. And Dr. Ash Jain, our cardiologist and medical director, and Dr. Mehegan, who is the co-medical director of the vascular services, will perform the screenings and do the interpretations. Fremont Bank will be co-sponsoring this. On February 1st, we have community education, Are You Having Trouble Falling Asleep? Dr. Nitun Verma, our sleeping medicine physician, will provide information regarding insomnia. He'll also discuss sleep patterns and the causes and treatment for sleep disorders. He will also share insights on how to get a good night's sleep. That should be interesting. Women's health. There's going to be a presentation on Lose the Salt, Keep the Flavor. It will be presented by one of our registered dietitians and certified diabetic educator on how to shop and prepare food that are low in sodium. February 2nd, we're going to have Diabetes Matters, Getting to the Heart of the Matter. And this will be from 7 to 8 o'clock in the evening. And again, Dr. Ash Jain, our cardiologist and medical director, will be one of the speakers talking about the relationship between diabetes and heart disease. On February 7th, we have the Community Outreach Newark Memorial High School Career Fair. That will be from 7:15 to 10 o'clock in the morning, and it will be in the Newark Memorial High School. Patricia Danielson, it says, a registered health information technologist, and Paula Grill, RN Manager of Health Promotions, will present on healthcare careers. February 7th, we have Stroke Education Series, Life After Stroke and Future in Diagnosis and Treatment, and that will be from 6 to 8 p.m. And again, Dr. Ash Jain, cardiologist and our medical director, and Doug Van Houten, RN, will present the program. The end of the 2001 was a very busy time in the foundation. The 16th annual Trees of Angels campaign attracted 600 attendees to the holiday tree lighting in Fremont, Union City, and Newark, and the annual Children's Holiday Breakfast was held. Generous donations and sponsors contributed $25,000 in support of hospice services through Tree of Angels. The end of the year, we also saw a number of generous donations to the foundation from community partners. For the 4th year in a row, Aeropostale, a clothing store in the New York Park Mall, donated 50 big, beautiful teddy bears for our pediatric patients. And on December 21st, the students and faculty of Wyotech, an automotive and motorcycle repair shop in Fremont, roared into the parking lot of Washington West on their motorcycles to deliver over 200 toys and games. Finally, on December 22nd, Robert Arrico, I'm going to get it here, just hang on. Inky's Tattoo Parlor, now that's kind of tough, in Fremont presented the foundation with a check for $4,000 for cancer services collected from patrons during the holiday season. I was thinking about our tattoo parlor removal, and I was getting hung up with that rather than Inky's Tattoo Parlor to put one on. Washington on Wheels Mobile Health Clinic. During the month of December, Washington on Wheels Mobile Health Clinic continued to serve community members at the Fremont Senior Center, the Fremont Family Resource Center, the Silliman Activity Center in Newark, the Rugi Senior Center in Union City, and the NUMI Re-Employment Center. The WOW Clinic also provided health care services to students and family members at Irvington High School, Kennedy High School, Robertson High School, Breyer Elementary School, and Grimmer Elementary School, all in Fremont. WOW provided occupational health services to employees of the Newark Unified School District. Tuberculosis screening services were provided. So next, I have the internet marketing information. For the month of December 2011, Washington Hospital Healthcare System's website had 25,396 visits and 17,827 unique visits, which resulted in 77,764 page visits. The links most visited on our site included employment services with 13,898 page views, the Physicians Finder section with 13,687 page views, the Volunteers page with 7,231 page views, the About Washington section with 6,293 page views, and the Women's Health and Pregnancy section with 2,968 page views. That's a lot of numbers. Okay, Channel 78 in InHealth. During the month of December, InHealth staff completed a variety of shootings, including a health and wellness class, wound care and the latest treatment options presented by Dr. Killaroo, and a Diabetes Matters program, What's New? Diabetes Update, presented by Vida Reed, our certified diabetes educator. We concluded the holiday wish tree, collecting over 100 gifts for children at the Cincy Center. Cincy Center for Children and Families is a leading innovator in the field of community-based and family-based service options for emotionally troubled children and their families. The Employee of the Month for January is David Garcia. David is a programmer analyst in information services. He joined Washington Hospital in 1999. He's a skilled programmer with a depth of healthcare information systems knowledge. The solutions he's developed are creative and thorough, with focus on the patient-first ethic and operational improvements. David is well respected by his IS teammates for his skill and collaborative approach.
Thank you, Jan. Any questions? Okay. Stephanie, we'll move right into the quality report.
Tonight, the highlight is going to be on our spine program. The spine program is one component of the Taylor McAdam Bell Neuroscience Program. The goal is to continue to provide district residents with high-quality, comprehensive, efficient, and very cost-effective care. When you look at a program, it takes more than one part to make that program successful. The program participants, it's multidisciplinary. It consists of both the inpatient and the outpatient areas. When you look at it from the inpatient side, it is truly multidisciplinary in terms of every aspect that relates to the spine, including the OR, food and nutrition, case management, community relations. So it's really looking at it from a programmatic standpoint, and that's one of the reasons the spine program is so successful. It also integrates with the Washington Outpatient Rehab Center, as well as the hospital clinics and the Outpatient Surgery Center. Here are some of the program participants. Dr. Desmond Erasmus is the medical director for the spine program. Most of these patients are housed on the 6 West unit, and you see there Alice Santos. Many people are very familiar with Alice Santos. Lauren Lucas is also the manager on that unit. But when you look at the participant, it's truly multidisciplinary. We have the OR involved, we have pharmacy, we have rehab is a very integral part of this whole program. Looking at utilization, the number of spine surgeries have remained consistent from year to year. It's pretty much consistent. When you look at the length of stay, it's on the increase, but we're looking at more complex patients. Some of the patients, the complexity of the patients are increasing. Let's look at some of their accomplishments, and these are just a few of their accomplishments in terms of what they have done over the past year. There continues to be monthly spine meetings that is truly multidisciplinary. It involves all of the disciplines, including the OR. They continue to revise the protocol and procedures for new techniques that they have done, for instance, the lumbar drain management. There's a lot of education that takes place, and there's education of the staff, education of the public, education of the patient. And there is a dedicated site to the neuroscience that talks about the calendar and the type of education that's being done. We have an online internet CRANES education, which patients can access from the outside as well, so they can do it from both from an inpatient standpoint, but they can also do it from at home. And that's pretty much where we give most of our outpatient education when we send a patient home. There has been revision to order sets. And one of the things that they have changed in terms of looking at best practices out there is the Vista color. They have gone to a softer color that's more comfortable for the patient and does a better job of keeping the spine in line. They have implemented the pre-op classes, and they have been successful. So those patients are seen basically from a programmatic standpoint from the time they are scheduled for surgery. We are very much aware of the patient feedback. There are satisfaction surveys that are sent out to this particular population in terms of asking what can we do better? What are some of the things that we can improve upon? Looking at our infection rate for laminectomies, we were in the top 25% of hospitals with the lowest surgical site infections. We continue to advertise in terms of what's good about our program, and with articles in the Tri-City Voice, and you have seen programs on InHealth as well. One of the things that Dr. Erasmus has continued to do is to make referrals to outpatient to the Legacy Physical Therapy Program. And this is very new and innovative. It goes beyond the traditional physical therapy. It's slow motion physical therapy that takes into consideration other techniques that are proving to be evidence-based and best practice out there and very successful with patients. They're also looking at a project as it relates to pain management. That has been one of the concerns of this patient population, and they have that's being addressed at this point in time. One of the components of the spine program is we talk about core measure, and they fall under the SCIP, which is the prevention of surgical site infections. And for the year 2011, they were 100% in all of their measures as it relates to the timing of antibiotic, the right selection of the antibiotic, the appropriate discontinuation of antibiotics, removing the hair, removing the Foley catheter at the right time so it doesn't pose additional risk of infection. They look at the medication that the patients were on before surgery and make sure that it's continued prior to surgery or during surgery if necessary, and the prevention of deep vein clots. As you know, Washington has a tradition of providing education programs, and the spine program is no exception. The neuroscience there's an annual neuroscience symposium that's very well known worldwide. We do continue to do a lot of community outreach. There's Grand Rounds, which is education for the medical staff and the employees as well, which includes nursing. They continue to provide lectures in terms of what's best out there in terms of the quality of care as it relates to the spine program. And they have done a lot of education within the Tri-City Voice and also on the spine website. And there is a website there that anyone can access from the outside. In terms of future steps, I think one of the goals of the program, as Dr. Erasmus has said, is to continue to get most of these patients to the outpatient rehab center. And one of the goals, as he put it, is there is a lot of non-medical, non-surgical patients out there that are spine patients that we need to be able to take a look at. So there's other stuff that's being developed. So this is just a quick overview of what the spine programs entail for the annual year of 2011. Any questions?
Questions? Thank you, Stephanie. Thank you very much. All right, then we're going to move to the finance report with Chris Henry. Chris?
Okay, tonight I'll be reviewing the operational and financial results for November. And once I get through that, I will present the December operational report on behalf of Ms. Farber. Okay, so average daily census for November was 8.4 below budget at 171.4. We saw 1,001 admissions during the month. We had expected 1,008, so admissions pretty close to budget. But patient days, 253 below budget at 5,141, resulting in an average length of stay on a discharge basis of 4.86, almost 0.5 below what we had expected the budget of 5.35. Case mix index in November continued to be lower than we had expected. Case mix for November was 1.346. We'd expected 1.642, and 462, and you'll see that play out in these statistics. Deliveries for the month came in at 153. That was one above the budget of 152. Surgical cases were 45 below budget at 329. That included joint replacement cases that came in pretty close to budget at 100. We'd expected 101. Neurosurgical cases were 7 below budget at 12. And our cardiac surgical cases were 9 below budget at 7. PTCA procedures for the month were 20 below budget at 44. Outpatient visits in November were below budget. We'd expected 8,579. We saw 8,579. We expected 8,922. And the emergency room saw 209 fewer patients than we had expected at 3,945. Looking at productivity very quickly, our productive full-time equivalents for the month were 30.1 below budget at 1,345.9. We had 241.9 non-productive FTEs for the month, giving us total FTEs 24.1 above the budget at 1,587.8. So that variance really driven by non-productive FTEs as managers tried to flex down their staff for the activity and get folks out of the house. Full-time equivalents per adjusted occupied bed, which is our productivity measure for the month, came in at 7.15. We'd expected 6.77. Moving into the financials, total patient revenue for November was almost $7.4 million below the budget at $147,648,000. Our contractual write-offs for the month came in very close to budget at 74.35%, giving us net operating revenue, and of course this is our Governmental Accounting Standards Board presentation, net operating revenue almost $2 million below budget at $38,168,000. Operating expenses for the month came in $424,000 above the budget at $38,581,000, and the big driver there was health and welfare claims. We continue to see not just high dollar claims, but a high number of claims this year, much higher than we had expected. So we end November with an operating bottom line just a little under $2.4 million below budget, and actually a loss of $413,000 for the month. Non-operating income for the month was $218,000 below budget at $1,041,000. So we end November with a total bottom line from a GASB perspective, almost $2.6 million below budget at $628,000. take a quick look at our Financial Accounting Standards Board presentation, and this is the presentation used for our audited financials. Operating bottom line stays the same, showing a $413,000 loss. We remove our general obligation bond revenue and our unrealized gains and losses on investments to come up with non-operating income from a FASB perspective of about $531,000 above the budget at $1,133,000, and a total bottom line from a FASB perspective of $720,000. So if there are no questions on November, I'll move into December results.
Any questions? Any thoughts about the reasons for the top line patient revenue decline?
Yeah, you know, if you noticed, our admissions are really holding the line with the budget. In fact, year to date, they're a bit above budget. It's a service mix issue, and I think it's something that I'm hearing from my colleagues in other hospitals that they're experiencing too. It's a lot of medical patients right now, not so much surgical volume, and it's something we're going to have to continue to watch. You know, traditionally, late summer, fall, early winter for us have been our slower periods, and then we get busy in late winter and spring, and so we'll have to see how things develop this year. It may be that we're returning to a more traditional pattern than what we've seen the last couple of years, but time will tell on that.
Okay, thank you, Chris.
Sure. Okay, move into December results. December saw, the month of December saw 1,123 patient admissions that resulted in 5,610 days of care. The average daily census for December was 181. This average daily census was higher compared to November's average daily census of 171. The budget for December anticipated 1,109 admissions and 5,890 days of care and an average daily census of 190. Therefore, we will be approximately 280 days of care below the budget for the month. December 2010, the average daily census was 185 with 5,729 days of care. Average length of stay for December was lower than budgeted at 5.47. The budget had anticipated an average length of stay of 5.31. Preliminary information indicates that the inpatient revenue for the month of December amounted to approximately $126,694,000 compared to a budgeted estimate of $132,204,000. Of this amount, 45.5% was Medicare and 12.6% was Medi-Cal for a program total of 58.1%. This compares with the budgeted inpatient revenue percentages of 48.8% Medicare and 12.5% Medi-Cal, or a total of 61.3% program revenue for inpatient services. So we did see fewer governmental sponsored patients in the month. The birthing center saw 153 deliveries in December compared to a budget of 165. December's deliveries resulted in 342 baby days. Newborns totaled 153 in the month. For comparison, there were 158 deliveries in the hospital in December 2010. For the month of December, there were 335 surgical cases in the hospital versus a budget of 377. This includes cardiac surgical cases that were 3 below the budget at 10. Inpatient surgical activity was below budget by 52 cases, while outpatient surgeries were above budget by 10. 573 cases were seen at the outpatient surgery center versus a budget of 549. For the month of December, there were 353 cases seen in the cath lab, including 49 PTCAs. Total cath lab cases were lower than budget by 82. And PTCAs were lower than budget by 18. Outpatient visits for the month of December were 8,328 and were below the budget of 8,541 and lower than December 2010 visits of 8,464. The emergency room recorded a total of 4,321 patients. That was a daily average of 139. And this was 73 above the budget of 4,248. The The Washington, Warm Springs, Newark, Nakamura, Ohlone, and Walmart clinics saw approximately 3,612 visits during December. So we end December with total emergency room and clinic visits of 7,933 compared to a budget of 8,973 visits. Full-time equivalents for the month of December totaled 1,582, including 32.2 agency personnel. This was lower than the budget of 1,621 FTEs. FTEs per adjusted occupied bed were 6.87, which is just slightly above the budget of 6.77. Productive FTEs were below budget by 29 for the month, and non-productive FTEs for December were below budget by 10 FTEs. So in summary, December had 14 more admissions and 280 fewer patient days than anticipated in the budget. Surgical cases were below budget by 42, and cath lab procedures were below budget by 82. Outpatient visits for December were 213 below budget, while ER visits were 73 above the budget. Clinic visits for the month were below budget by 1,113. Total paid FTEs are below budget by 39 for the month and below the last 12 months average by 16.1 FTEs. FTEs per AOB were just slightly above budget. Inpatient charges for December are lower than budget by approximately $5.5 million. Outpatient charges were slightly higher than budget by $26,000. So total hospital charges for the month of December are below budget by approximately $5.5 million. On December 31st, there were 160 days cash on hand. Total days revenue and accounts receivable at December 31st was 70.25. Days revenue and accounts receivable excluding Medi-Cal was 57.37. Medi-Cal did essentially halt the TAR process in December, so we were not able to get any of our Medi-Cal cases approved for billing in December. During the month of December, $2,331,000 of charges was approved or pending for charity assistance.
Thank you. Questions, anyone? Thank you, Chris. Okay, at this point, we're going to move to the action items. The first item on the agenda was a consideration and commendation for Al Nagy, who is a member of our DevCo board, but we're going to postpone that until next month's meeting. So we are now going to move to consideration of the reappointment of the Development Corporation board members. Ms. Danielson?
Mr. President, I move for the reappointment of Ben Saw, MD, Shirley Bushke, James Stone, and Myro Garcia to the Washington Hospital Development Corporation Board of Directors for 2012.
Thank you. Do you have a second? Okay. Any questions or comments?
These are wonderful people who do a great job for us.
Yep. Okay, all those in favor? Aye?
Aye.
Opposed? Motion passes. Is there any business for closed session? Okay, thank you all this evening for coming, and this meeting is now adjourned.
Okay, so you hold the record.
That's your record, yes.
Jen.